Hip and knee replacements are made of two basic materials, metal and plastic. The metals used in joint replacement can be a cobalt and chromium alloy or a titanium alloy, depending on the type of implant used. In my practice, I also use components made of a special metal called oxinium. Oxinium is an oxidized zirconium, which makes for a surface that is extremely smooth. A smooth surface is important, as the metal articulates with or rubs against a plastic spacer. You can think of the plastic as the new cartilage inside of the joint. The plastics are highly engineered to be both strong and smooth, so they do not wear out over time. The combination of a very smooth metal, like oxinium, and what we call a highly cross-linked polyethylene, or plastic, creates a new joint surface that moves together with very little wear. We anticipate that modern joint replacements should last 20 to 25 or more years with regular use.